All right, we're here tonight to talk a little bit about the vaccine and some related measures regarding COVID. And for the purposes of this process, we've purposely started with the mask on because we're here to point out that once you get the vaccine, mask and other social distancing and other elements are still very important. But for the people we have in the room, we're going to be isolated enough in addition to I've already had the vaccine, so some protections going on. But we'll be able to understand and to enunciate a little better. So for those of you that read lips, we have Barb Mask who's going to assist us for a question and answer type of session so that we can have some better understanding of about the vaccine. So Barb, go ahead there if you would.
And just want to thank you and Aaron both for putting this public service together for the people in Fulton. Thank you so much. How does the vaccine really fit into this herd immunity? We keep hearing that term.
You bet. Well, the concept of herd immunity is getting enough people with either the actual infection, okay, and or the immunizations, vaccine, so that whereas the virus is never totally gone from an environment, from our city, our county, our country, however we want to look at it, is smoldering so that it doesn't catch on and have the contagiosity, meaning the ability to affect as many people, and strangely, often not striking them as prominently as it were before. Because when the virus doesn't have the constant source to feed on, okay, it starts to wane a little bit in that aspect as well, according to some of our experts.
Okay, who all should get the vaccine? We've heard how the CDC has come out with some guidelines, the elderly first and healthcare workers, but should everybody be getting it?
Well, of course it is a triage policy, beginning, as you say, with the elderly, and I think in hindsight we would have all done much better to have identified people and said, okay, let's start with 90-year-olds, okay, here's 85, 80, hindsight. You could have graded people according to the severity of their chronic illnesses in that mix and had a nice, again, more effective. But when the vaccine is limited, you're kind of, boom, everything's flying by the seat of your pants. But that having been said, the best recommendation is for all adults, okay? And so it's not been approved for kids. They've not been as nearly impacted by this, although we were talking about from somebody from close connections with this community who was out at Iowa City as a young individual and has been in the news. But the bottom line is that until the vaccine is approved in kids, we're just staying adults, however we want to define that. But again, as a young, healthy adult, getting the vaccination not only protects yourself, and for the record, and I don't think, Aaron, that we went into this the last time, but the death rate of young people 25 to 40-ish is up substantially during the COVID process. So, it's not a high rate to begin with, and I'm not saying it's off the wall, okay? But by the same token, it is up noticeably, and we don't have anything else to attribute it. After all, accidents are less because people are driving less. Other infections are less because people are not socializing as much, but it was up from the COVID. So, one of the things in that regard. And so, yeah, basically, all adults, and then there is a hierarchy, there's an availability. That's going to be solved over time. Go ahead, there's something else I had in mind,
Well,
Barb, I'll come back to it.
the next question is one I hear a lot. If you've already had the COVID-19, do you still need to get the vaccine?
It's an interesting process. So for years the thinking has been, still to a fair degree, is look, natural immunity is better than vaccination. I've been a proponent of that. When my kids were growing up, they remember the chicken pox exposure we tried to do, and it was effective, by the way, okay? But by the same token, it's being rethought for lots of different reasons, that with this vaccine, you may well get additional protections that are not conferred automatically by virtue of having the vaccine that may last longer, There looks to be some suggestion that we will have protection against the variants that might not be fully there in terms of with the natural original COVID infections. So several aspects in that regard that come into play.
Well, and the next question follows, right, is the natural infection better than the vaccine?
Yeah, again, I think traditionally we would have thought about that process. And I just have to say that I don't know that we can necessarily think that it's hard to discard that way of thinking because we've had it so long. I think what that lends itself so much related question here is, you know, what's unique about this vaccine? A lot of people are looking and saying, oh, this seems like a rush job, okay? But saying that this is a rush job is like, you know, people from 100 years ago looking at all the stuff we do technological wise and say, I mean, my cell phone's a rush job. I mean, let's don't go into this so quickly here, right? This is not a rush job. The science has been out there for the better part of 20 years. We've had the technology. We actually were starting to implement this type of process with some of the other viruses that died out due to social control, et cetera, that happened. And so it's not a rush job. I mean, what happened when the mumps vaccine came out around 1960, this is a rush job because it was only 4 years, okay, that we studied this. You know, now we study this for a few months, but here's some things to know about the vaccine in general. Every vaccine in history, we have known 99% of the reactions that occur within 3 months. We were way past 3 months, okay? And so the science was there, the safety is there. I think there's some questions about that we have coming up. But go ahead with that.
My next one is concerning the vaccine and all the variants that are now coming out.
Okay. Yeah, there's two schools of thought on the variants, okay? One is in regard to the technology, that if we do need to have an adjustment, the variants are just boom, just a few simple steps and it's done. Okay.
That's good news.
And very good,
Good
very
news.
good. The other thing is, so far, there's some evidence that our leading vaccines, our earliest ones that we introduced, look to have some reasonable effectiveness against serious COVID variant. Okay, so yes.
And then the next one is, how effective is this vaccine? How does it compare
Okay.
with other vaccines?
Well, let's tie into internet hype. We had a brief discussion about internet hype, so let's tie into internet hype and you know, do my best serious face to look in the internet and say, when they tell you that the vaccine is 90% effective, that is a lie. Now, why is that? Okay. The reason it's a lie is because it's 99.99, and here's what we mean. So when you're doing the trial, you are obligated to report any and all things that happen. That's just the rules of a scientific trial, FDA or otherwise. And so we must record all infections. We swabbed the nose after this, you got it, you had a mild, you had a modest infection. But the incidence of serious infection in the more than 75,000 people who were in the combined pool trials to this date, so starting nearly a year ago, but to this date is exactly 1 serious infection. So despite the internet hype out there, it is 1, and I defy somebody to show me differently.
So following on that line of thought, so it is effective, but what about the side effects? Somebody's always
You bet.
concerned about
Again, it's
that.
internet hype, but the internet hype is fostered by the news media. Okay, so when election hysteria dies down and impeachment hysteria dies down, we have to have something to tune you in for fear, and so we're going to fearmonger, and we're going to play off the fear and say another bad reaction. Okay. Statistics run by the government, non-vested parties that don't have a financial tie and otherwise. The incidence of serious infections, despite the news hype, is 1 in 100,000 on the original studies. I saw in one of our leading journals last week an incident that would have had it anywhere from 1 in 250,000 to less than that. So everybody knows somebody had something, this and that, but serious reactions, very, very uncommon.
Well, that's
Compared to
good
the
news.
death, compared to the
Right,
deaths.
yes, yeah.
So-
Well, that's good news.
Right,
Yeah.
very good news.
What about this association with the DNA? Does this vaccine
There
actually
is no
alter DNA?
alteration for the DNA. Again, the science is unique, the messenger RNA system. That's one thing the news has done well, is to parley out there information that's useful from some scientific information. But it's rather unique. But the government is not going to track you. Okay, there's not any remote possibility about that. You know, I will tell you what, they can track you right now from this for anybody that doesn't think they can, right?
I said that
So-
to somebody who was claiming that to me, and I said, well, they already track you.
They already
with your
track
phone.
you. Okay, but there's nothing about altering your DNA. And I readily took the shot. I had the series done, and I was positive for the antibodies without virtue of ever having an infection. So I'm the answer to your question. But I get it. I did, got it. You know, boom, had the antibodies already. So yes, indeed.
Have you had your second dose as well?
Yeah, I'm complete with the
You're
series
complete.
now. Yes.
No side effects with the second?
I had sore arms, and as a notion, I mean, this is somewhat anecdotal, but it makes it more personal. So the first time, you know, I awoke 8 or 10 hours after the shot, and you know, you're in the middle of your sleep, and you know, I must have worked out my arm, and after a few minutes you realize, oh, wait, I had a shot there, right? And so yeah, I wrestled with that for a night or two. It didn't affect me during the day much. Second go around, what we did is I did some infrared treatment to the arm and had 0 issues. My wife had her first one last week, did the infrared, and also 0 problems with that.
And tell me about that. Is that something you've easily done?
You know, I never got the infrared. It was coincidental. I got it in between. I was getting it for other aches and pains type of process, and I happened to employ it for the process of the immunization, but
Over the counter?
coincidental. Yeah, it's over the counter. I mean, if you're going to get a good system, it's going to cost you a few $100, but I had enough aches and pains, I decided it was worth it.
Worth the investment.
But it's totally separate from the vaccine.
Oh, I know one thing I hear a lot from people is how soon after I get the vaccine or vaccines, second dose too, am I safe?
Sure.
How long?
Yeah, well, you know, safe is a relative term. We started by talking out that until we have really good herd immunity, we need masks, we need social distancing like we're doing in this room now. And so that isn't going to go away. But the standard time, the same answer is the answer for when is it reasonable to get a shot after the infection. That's 2 weeks. Think maybe 3. So 2 to 3 weeks is the best information that we have available.
After the second one, then
Yes.
another 2 weeks.
Right.
Okay. Can I still transmit the disease after I have been vaccinated?
Well, it's interesting. We would think that the logical answer would be yes, you may. Okay, because I might walk out into the waiting room, contact somebody, I've got the vaccine, maybe I'm a little cavalier, I'm not so worried, but whatever. Unwittingly, I come in contact with somebody who asymptomatic carrier. We exchange germs or whatever in the social milieu, and so I'm walking back into my next patient. Now, you know, we like to think we're careful with the hands and the social, but lo and behold, okay. But the interesting thing is, well, theoretically that's possible. Science is trying to see if that actually happens, and right now they have no evidence of that happening. So it's not that it can't, and it's not that we should be cavalier, it's just that maybe that's another benefit.
So if the virus gets in your nose and you have been vaccinated or you have had the COVID and you're
Right.
assuming you have some immunity, can you still then pass that on to somebody else even if you don't have any symptoms?
Well, theoretically that's possible. What I'm saying though is it looks like we're reasonably covered under those circumstances, and it's not to promote cavalier responses, but to say, hey, that looks like a bonus. So.
And then of course the question most frequently asked is, how long do I have to continue to wear the mask and do the social
Sure. It's
distancing
an
after I'm
unknown.
vaccinated, after I've had the disease?
The vaccine itself will not directly lead to diminishing of the social distancing and the masking. But it's going to contribute, all those measures are collectively going to contribute back to our first topic of herd immunity. So that's an unknown. I mean, a month ago, we would not have predicted that we would have a rather precipitous decline in both activity, new cases, and death rate. We would not have predicted that.
It's been a good thing to read that.
It's been a good thing.
Yeah.
So, we'll take it. Nobody understands entirely how that happened, but it looks to be the social phenomena that are the issue as much as anything.